What is the importance of early detection and early intervention in the deafness? The program which has been set to start the hearing assessment of every born child before 1 month of the age of the child, child's hearing screening is must, regardless of whether it's a high risk or low risk pregnancy, whether the child had eventful postnatal period. 60% of them are the normal born children and the 40% are the high risk children. So regardless of any factor, we need to evaluate every born children. No child should be discharged from the hospital without their hearing assessment being done. That is one. Within 3 months, we should confirm the diagnosis that child is hearing normal or not. And within 6 months, we should intervene the child. The treatment should start within the 6 months. We did the youngest 9-month-old children cochlear implant recently. So why? Because it's in a golden time limit within which we should act upon. That is the biggest problem in our country. Within 3 years of the life of our children, if you give them a normal hearing, the chances of mainstreaming the child is 90%. If you intervene the child within the 1 year, the 99% child will have mainstreaming. And if you intervene the child below 1 year, 100% normal hearing we can give. So that is the golden period which you should not lose. During that period, if the hearing is not given, our auditory cortex is dominated by visual cortex. So the hearing area is taken over by the vision. The child doesn't want to hear, they just want to see. If you give the instructions verbally, he will wait for the gestures to happen. And then it's very difficult to educate the child once he is a visually dependent child. Even if you give the hearing, after a certain age, child will not be brought back to the normal life. So that's a golden period we have to embark upon. And that happens because if you don't use that function, it is lost. Either use it or lose it permanently. And that, once we put an implant and give the brain, before the connections develop in the brain, then that implant is easily connected and the integration happens with the brain very easily. So early diagnosis and early intervention is the key component of this program. This is how it happens. At birth, there are few fibers connected, and at the age of the 2 years are maximum. If the implant doesn't happen in this period, it starts deteriorating. By the age of 6, there is almost 50% of the neurons are almost died. So after the age of the 6, there is hardly any benefit of implanting the child. What are the causes? Why we are not able to get the patients before the age of 3? There are multiple socioeconomic causes. Elderly in the family having the myths that surgery itself is a very complex and my child will not survive out of the surgery. That's a myth which many senior citizens are carrying. Second, it's a ladder. Then visual responses which child gives is considered as a auditory responses. If you ask the child to get the water, so you are already directing the child to the water. So he understands the water by finger and not by hearing. And we understand that the child is following the instructions in the initial stage, and that misleads us that a child is able to hear. Second is non-visiting to the proper healthcare professionals. That misleads many of the parents. The बच्चा बड़ा होगा, सुनेगा, आपके फैमिली में बहुत लोग लेट भी बोले, लेट भी सुने. That kind of loose comments are delaying the diagnosis. Lack of diagnostic facilities at the many places in the rural areas and the cost of the treatment. So we have taken care of all these, and the number of implantees which we have, 90% they are below 3. So what are the steps normally we follow when the parents bring the child with an suspected hearing impaired child? So we do an evaluation, ENT examination, audiological to confirm the diagnosis, radiology, whether it is an implantable situation or not. We give hearing aid trial to every child to condition the child to wear something. Otherwise, child will throw the cochlear implant. We have to condition the child's brain to the hearing aid, then he will take up the cochlear implant. Vaccination, surgery, switch on, audioverbal therapy, and then the progress monitoring and then mainstreaming of the child. These are the steps through which this program has to run. How does the hearing aid work? Hearing aid amplifies the sound and gives the sound to the cochlea. If the cochlea is normal, that sound, amplified sound will reach to the brain. And how does the cochlear implant work? It directly stimulates the nerve. It bypasses the damaged cochlea. What is the ideal age at which the cochlear implant surgery can be performed? Any age. For those children which are prelingual children, earliest is better, but 5 years of deprivation is the limitation. In the adult and the old age, if the deprivation is less than 5 years, cochlear implant is the best solution. If the deprivation is more than 5 years, it might compromise on the outcome. But any age, the fitness for surgery is required. The geriatric population, a lot of Western countries, old age patients are receiving cochlear implant. But the commonest cause of domestic quarrels is the mishearing. They hear something and understand something else, and the family life is disturbed. So with the hearing aid also, their interpretation is not that good. So those who are not deriving adequate benefit from the hearing aid, the old age population is now turning towards cochlear implant. In our country, the geriatric population is very less, the number of implants they are receiving. They are still managing with whatever the hearing they have. And many geriatrics prefer not to hear anything from others. They make others to hear. And the adult population is a huge number. Those who, because of the lack of good hearing, they lose their job. The family life is totally shattered. And they can be totally brought back to their work by giving them a normal hearing, by doing cochlear implant. And that is a huge number. And a lot of patients with the noise-induced deafness, ototoxicity, after meningitis, after ear infections, they lose hearing completely. Now, how to choose? This is the graph which guides us which category falls in the cochlear implant, which category falls into. How long the cochlear implant works? Unlimited time. Once it is implanted, it is implanted. The oldest person who has received a cochlear implant as a first cochlear implant, he is now 79 and using this implant from last 33 years, seamlessly. What is the cost? We are doing it at a zero cost. There is no cost to the patient. We are generating funds from other sources and doing it free for the patient. In spite of that, the numbers are not adequate. That's because of the myths which are coming in. And we have a huge team working behind this program. It starts from the radiologist, Dr. Ankit Shah, great support anesthesia team, my department, audiology, administration, OT staff. It's an entirely different ball game altogether, but all of them are together to deliver at no extra cost. Role of audioverbal therapy is great. The simplest job is mine, just to put an implant, but to rehabilitate the patient, the therapy is must. And the therapy gives the results. Now see the results. This child was implanted when he was 12 months old.
आइसक्रीम कहाँ है? आइसक्रीम आइसक्रीम दे दो. कैसे खाते हैं? हाँ दे दो दे दो. ओके सुनो ना निशु, टेलीफोन कहाँ है? टेलीफोन पापा से बात करेंगे ना. हेलो हेलो. वाह टेलीफोन है, बात कर लो, पापा से बात करो. हेलो पापा आओ.
मेरे बच्चे का नाम निशिव जितेश भानुशाली है. ये 9 महीने का था. उसके बाद हमको पता चला कि ये इसको सुनाई नहीं दे रही है. उसके बाद हमने रिपोर्टिंग वापी में कराया तो उसको आया कि उसको 90% एयरिंग लॉस है. इसके बाद हमको भरत मेंगर भाई ने बोला कि यहाँ गीतांजलि करके मैडम है, उसकी श्रावणी स्पीच एंड हियरिंग थेरापी है बोरीवली में, तो उधर आके मैडम से मिलो.
Another child was diagnosed with the absent hearing nerve, that is auditory nerve, on MRI. But finally, we could judge the child has some hearing mechanism left. So we decided to go ahead with the cochlear implant.